Now, to introduce our next speaker, I want to tell you a little bit how the field of medicine has drastically changed over the past generation. When I started medical school, the practice of medicine was very paternalistic. The doctor basically saw the patient and the family and told them what needed to be done, and that was it. That's all turned upside down. Now, our model of optimal practice of medicine is that it is a collaboration. And it's a collaboration where we, the clinicians, guide, but you, the patients and the family, you ultimately are the ones who decide. And part of that collaboration means that you have to understand some of the basics, like the clotting system, in order to make informed decisions. But you also have to be your own healthcare advocate. The North American Thrombosis Forum, NATF, our nonprofit organization, puts a lot of emphasis on advocacy, on patient advocacy and patient involvement. And you'll be able to learn more about NATF and how you can become involved with it during the exhibit fair at lunchtime. But one of the driving forces for being one's own healthcare advocate is our next speaker, Henry Hagopian, who I believe is going to share a little of his personal story with us as sort of a case example of what we can learn from this. Henry, I believe you have an MBA along with some other degrees, and I believe that the business school model of education is entirely or mostly case-based. You take actually a real case, you review what went on, what was right, what was wrong about it. You take that as a jumping off point for learning. Henry, not coincidentally, is a major force in our NATF program on patient advocacy, and has been a major organizer of many of our key patient, public, clinician events over the past 6 years that NATF has existed. So Henry, welcome to the second annual patient seminar. We look forward to learning from you.
I plan to share some of my personal story with you and hope it's, as Dr. Goldhaber said, a good example of kind of advocating for your own health care. My experience with DVT started pretty innocently enough with I found a small bump behind my left knee in January 2007, and it was no bigger than the head of a pencil. So I kind of ignored it, thought it was just maybe a blocked oil gland in the skin and would go away on its own. Well, it didn't. It stayed around a little while. It got progressively bigger, about the size of a dime. Then once it progressed to the size of a quarter, I called my primary care physician and asked to go see him. And when I went to visit him, he diagnosed it as just a harmless Baker's cyst. Basically, some fluid from the knee joint had escaped behind the joint and collected behind my knee. And he said, most of these, about 50% of them, resolve on their own. They'll just burst, and you may feel a little pressure, but it should be fine. Just ignore it. So by this time, this was probably this early spring of that year, and I took his advice. Well, it didn't go away. It kept getting bigger and bigger, and I finally really insisted that I get a referral. Now, at the time, through my prior employer, I was in an HMO, so he was really reluctant initially to give me a referral to an orthopedic surgeon, but I pressed him really hard, and about April, I visited an orthopedic surgeon in the same medical center that's outside of 128, that's all I'll say. But I met this first orthopedic surgeon, and he spent all of 4 minutes with me. And this was really disconcerting because he said to me, I can't tell you anything until I see an MRI. So here's a prescription, go get that done and come back and see me. And that was really upsetting to me. I'm someone who's kind of intellectually curious. I asked a lot of questions, and he just didn't want to hear it that day. So when I had the MRI and went back and asked to see someone else in the same facility, and I didn't know at the time, but I was seeing the vice chairman of orthopedics. So he came in and was a little demeaning, and he said, "Why are you seeing me today? What was wrong with Dr. Williams?" Not his real name. And I said, "Well, this is a situation, this is what I'm saying." And he looked at my results and he said, "You need major open knee surgery. We're going to have to open your knee from behind. You're going to be off your feet for 2 weeks. You'll be in rehab for 10 weeks. I said, "Whoa, just from this little cyst, this doesn't seem right." And I just couldn't picture that because I was working in a very high-stress corporate environment. I knew that wasn't going to go over very well. And so I thought about it. I took his advice, and I called back to my primary care, and I asked, I wanted a second opinion. I wanted to go to Boston for a second opinion. I said, I can't understand this with all the advances in arthroscopic surgery today. Why can't, especially with knees, why can't they do this with a scope? And that took some doing. Initially, I got a lot of resistance. Again, I think part of that HMO model, there's demerits for giving referrals off to other institutions. And it took about another month or so to get that. It took into the summer before they would agree to give me a referral. And I picked Brigham and Women's as where I wanted to go. There was a surgeon there I had researched. So it wasn't until, I'd say, August that I was able to get that opinion. And I visited this wonderful surgeon at Brigham and Women's who's moved on in his career now and is chairman of orthopedics in Philadelphia. But he was a terrific, caring individual that sat down and talked to me and said, "Henry, the last thing we'd recommend is opening your knee from behind. That's just major surgery. We can do so much with a scope today." And they didn't like the MRI image wasn't clear, so he wanted a repeat MRI at Brigham, which has a much stronger machine. The power of the magnet is about 3 times what I had been tested with. So after that got done, we had pretty much scheduled surgery. I had to take several cross-country flights for business early in the month, and early in August I flew out to California for about 4 days, so the cross-country flight really didn't help, and then I had to go to California and sit in meetings for 4 days straight and not really move around much. My last night out there, the Red Sox were in town playing the Angels, so with a couple colleagues we went to watch them. And I can remember after the game walking back through the parking lot, my leg was it just didn't feel right. It felt kind of achy, and so I went to sleep. The more I walked, it resolved itself. The next day I took a red eye back home to Boston, and I got stuck all the way in the back of the plane, and there was a family from Australia next to me. So I was in the window seat, and they had a small baby, and I knew all the risk factors going out. You drink a lot of water on long-haul flights. You try to get up and move every couple hours. But I fell asleep, and then when I woke up, they were asleep, and I didn't want to disturb them. So I ended up not moving that whole time on that flight, which was pretty bad. I came back, and my leg didn't feel all that bad, but it just didn't feel the same. And at this time, I was waiting I was going to have surgery at the end of August with the arthroscopic surgery. I had to take one more business trip during that time to Tampa, Florida for 3 days. And I can remember like it was yesterday. I was leaving my house about 5:30 in the morning to go to Logan, and it was just a beautiful sunny morning, and I just looked at my house. I had this eerie feeling like, was this going to be the last time I see this house? It was very bizarre. And so I took the trip. I almost had a thought to cancel it just by that feeling that came over me. But I trudged on. Like I said, I was working in this hard-charging corporate environment, and I had to move forward. So I took the trip. I got to Tampa. About a day into my trip there, my leg at night started to really bother me. I couldn't sleep. I was up all night almost. One night I remember going to a mall, just walking around because that was the only thing that made it feel any better. And again, the Red Sox were in town, so my last night in Tampa, I had to go see them. And I can remember walking back after the game. Again, my leg was just aching. So I was to fly out the next morning. I had some thoughts about going to the major hospital, Tampa General, but I said, if something's wrong with me, I don't want to get stuck down here 2,000 miles away from my family in Boston. So I took the flight. About halfway through the flight, my leg really started aching, and I did the worst possible thing. In hindsight now, I was just massaging it because that was the only thing that could help it feel better. And I thought it was a pulled muscle. I was rushing in the airport. The flight was really full. I had to really kind of twist myself odd to get my bag up in the carry-on. And then when I stepped off the plane and started walking through Logan, I had some thoughts. I got to my car in the garage and I just sat there for a few minutes. And part of me thought maybe I should just drive myself right over to Mass General. It was like 12:30 in the morning at this point. And I said, then my family's going to wake up. I'm not going to be there. They're going to wonder what happened to me. So I decided just to go home and go to sleep. And the next morning I stepped out of bed and I put my left leg on the floor. And it was the most intense pain I've ever felt in my life. Just shot right through my leg. So I debated what to do. I could have called my primary care at that other institution I mentioned to you. And I chose not to do that. I called the assistant to the orthopedic surgeon that I had met at Brigham and Women's and kind of described what I was feeling. Now, mind you, I was not officially his patient yet at all. I had just seen him for a consult. But she took my concerns so to heart. She tracked down the doctor, and this doctor also had done work at Dana-Farber, and that day he was treating bone cancer patients there. So she found him within 15 minutes and described my symptoms. And she called me right back and she said, Henry, I got Dr. Abraham on the phone. He's very concerned. He thinks you may have a blood clot in your leg. He wants you to get to the closest hospital as soon as possible. And I thanked her for finding him. And for me, the closest hospital would have been back to that other institution with that primary care physician that I didn't want to see. So I hung up with her and I thought about it a while, and then I called her back and I said, her name was Courtney, and I said, Courtney, is there any way I could come to Brigham and Women's? This is why I don't want to go back to that other doctor. And she said, let me try to find him again. Let's see what we can do. And probably within half an hour, she got back to me and she said, okay, we've arranged for you to come to Brigham and Women's. You can go direct to the vascular lab, and they'll be able to test you there. And so that was a day I'll never forget. I went to the vascular lab. The technician started preparing me for the ultrasound, and he started to test my right leg. And I said, time out here. The problem's in my left. Why are you testing my right? And he said, well, I'm sorry, it was written down wrong here. He goes, let me test it anyway. And he got toward my right knee, and his face changed a little bit. So they had found a clot superficially on my right side too. Then he started doing the left, and then he went down to the left calf, and his face just kind of dropped, and I knew something was wrong, and I had asked him to turn the screen because I wanted to see for myself too, and like clear as day you could see the blood just wasn't flowing through this vein. And he got very serious. He said, I need to go get one of the doctors, and he just closed all the lights. I can just remember, I never felt so alone in my life, just laying on this gurney in the vascular lab, and I was just all by myself. And my first thoughts were my daughters, who were visiting my parents in New Jersey at the time. I was wondering, would I ever see them again? Because my second thought was to David Bloom. I don't know if many of you remember. David Bloom was the NBC reporter who passed away in Iraq from a pulmonary embolism. He had been embedded for 3 weeks with the 3rd Infantry Division, and I'll never forget the day he died. It really was a shock. I had stayed up the night before watching his last reports from Iraq, and then the next morning hearing that he had died, I was just blown away. And I just thought, what a wonderful man that left his family, put himself in harm's way to give us a different perspective on war that we had never seen before as the American public. So I remembered what happened to David, and I said, could this happen to me as well? So thankfully, I was able to get right into the Brigham ER, and got treated pretty quickly with Lovenox. And within a few hours of that dose going into me, I could start feeling relief in my leg. It was almost like a miracle. But I'll never forget a nurse that I met in the ER. She took a real strong interest in me because she came over to the bed and she uncovered the blanket on my leg. She just stared down at my left leg and she just shaking her head. She said, "Henry, this shouldn't be happening to you." She said, "You're much too young for this. You have no risk factors. You have no family history. You're not obese." She said, I need to do something for you." She said, "We have a doctor here at Brigham and Women's that's one of the world's specialists in this field. Do you mind? And he does a lot of trials. Do you mind if I call him or try to reach him?" I said, "Of course." At that point, I'd do anything. I was willing to put myself in a trial if I had to. She said, "His name is Dr. Goldhaber. Let me find out." She came back about an hour later and she said, "I'm sorry, Dr. Goldhaber's at a conference in Europe right now, and because you've already been treated with Lovenox, it wouldn't make you eligible for any of the trials." But just her giving me his name meant a huge difference. Because I didn't have a physician at Brigham, I had to go back for my follow-up care with that primary care physician. And I'll never forget that first visit with him. He said, "This is no big DVT below the knees, that's no big deal." He said, 3 months on warfarin, you'll be fine. And I challenged him because I said, "Wait a minute." I said, the residents at the ER at Brigham and Women's said the newest protocol is a minimum of 6 months to resolve the clot. I said, "I don't feel comfortable with you telling me 3 months." He said, No, 3 months, that's it. You come see me and we'll take you off." And then at the time, I was being managed by that anticoagulation service, and that was also pretty upsetting because, as we heard just recently, it's very hard person to person to manage warfarin. There's so many differences. So initially, I was overdosed. My INR was over 5, and I got scared that I was going to have a brain hemorrhage. And then they got nervous, so they dropped the dose dramatically, and then my INR went down close to 1, and I was just yo-yoing back and forth for weeks on a time. And this was really upsetting to me. I said, I don't want to end up in a bad state. So I went back to the orthopedic surgeon's office at Brigham, and I said, "Please, is there any way you can do something here to help me? This is what's going on. I really don't like this." And they were trying to find someone. Now, in the interim, I had to go back to that primary, and so now it's November, and he said, "Okay, 3 more weeks of warfarin, you'll be done." Now, I had 2 clots in my left leg. One had resolved by this point, but I could still feel another one through the skin. I could still feel it. And I said, "Well, doctor, I can still feel this here. Can't you do a follow-up ultrasound?" He said, No. He said, "We typically don't do those." And he said, "Your insurance probably won't even be willing to pay for it." I said, "I don't care. I'll pay for it myself." He said, "No, you don't need it." So that was the end of the road for me. So at this point, I'm calling Courtney back at Dr. Abraham's office, begging her, "Please, this nurse told me about Dr. Goldhaber. Is there any way you could get me in to see him?" She said, "We'll see what we can do." She called me back about a day later, and she said, "Henry, the wait to see Dr. Goldhaber is probably going to be a couple months, but we could get you in to see one of his colleagues in about 3 weeks." And I said, "I'll take it." And that's where I was very fortunate to meet one of Dr. Goldhaber's colleagues, Dr. Marie Gerhard Herman at Brigham and Women's. Dr. Gerhard is the director of the vascular lab, and she was one of the most caring physicians I ever met. I'll never forget my first office visit with her. I started recanting some of the story to her, and she was facing the computer looking at my ultrasound results, and then she just spun around on the chair and she said, "Henry, I've heard enough." She said, "Come on, we're taking a field trip," and she just took me down to the vascular lab and picked a technician to retest me, and she left me there, and she said, "Now I have other patients to see, but I'll be back to check on you." And I said, "Oh yeah, well, let's see if I see her again today." But sure enough, an hour later she was back, and she was there, see the scan, clear as day. You could still see there was still a clot in the left leg. And I'll never forget her say, "Don't worry, we're going to take care of you here. You're going to be fine." And that just hearing her say those words to me just gave me a tremendous boost that someone cared, someone was going to take an interest and try to treat this properly. I think my main goal here in telling you this story today was just all of you, we all have similar stories, I'm sure, but you know your body best. And I think if you don't feel right, if you have a gut instinct, I think really is imperative that you make an effort. And I think there's so many physicians like Dr. Goldhaber, like some of the doctors I mentioned this morning that really take this collaborative approach. I think that listen to their patients and take their concerns to heart and try to treat them. That I think and I think what all of us are very fortunate of is to live in this area and have access to the care that we do here in the city of Boston. Thank you very much.
That's great. So, a very dramatic story, and I'm glad really it has a happy ending. But help us. You came to the table, so to speak, with several advantages that many of us don't have. Number one, you went to business school and you're in business. So you're being able to stand eyeball to eyeball with physicians, insurance companies. You're probably fearless. And, when a billing mistake is made on my own bills and they don't have my medical insurance number, I'm in fear of calling the billing office to speak to the billing person. So for those of us who don't have, who don't live in a world of negotiation and sort of taking a proactive approach, can you give us sort of negotiation 101 pointers?
I think that the main message that I've learned is just to be persistent and really insist that you feel this isn't right, you want something done about it, and really drive that message home. That I learned at an early age, maybe like Dr. Goldhaber said, maybe I had a different advantage. I watched my mother deal with my aging grandmother and all her problems, and even as she got older and older, she still was persistent. She didn't want to give up on her, and I think that was a good lesson and just in dealing in some of the corporate issues that I see day to day. But I think persistence really pays off.
I want to say that NATF, our organization, not only reaches out to patients, but we reach out to physicians and pharmacists and nurses with educational symposia. And our NATF philosophy is to have patients, their family, and the public present at the same higher scientific symposia that we have for the physicians. And our annual thrombosis summit will be Saturday, September 8th at the Fairmont Copley Plaza Hotel. If you log on to our NATF website about a month from now, registration for that will open because clearly I think what we're hearing, Henry, is that not only do we have to educate the patient and public about collaborating, but we as medical professionals have a lot more educational work to do with our own brothers and sisters in the field. Henry, thank you very much.